Hi everyone, welcome to this episode of Entrepreneur Showcase Series brought to you by Patranya Media LLC and Parkway Media Partners. I'm your host, Patranya Poonswan, and today we're putting a spotlight on a natural practice, medicine practice based right here in Las Vegas, Nevada. It's called Las Vegas Integrative Medicine, and we have two of the ladies behind this great clinic here in town. With us today, we have Dr. Yoojin Lee-Sedera. She's the clinic director as well as co-founder. And we have Dr. Rachel Ong. She's the associate doctor of Las Vegas Integrative Medicine. And also joining us in the studio with them is another amazing lady. Her name is Chris Thomas. She has many titles, but among them, she's the president of the Veterans Advocacy Council Community Development Corporation. And she's also a big supporter of alternative medicine and of this clinic. So we'll hear from Chris in just a bit, but first we want to get right into the nature of this clinic, which is quite different from many other medicine practice here in town, which I think is really unique. And for people, obviously we have new people coming into town all the time, and they want to hear about different kinds of practices we have here in town. So Yoojin, I'll start with you. I'll call you Yoojin, and Rachel,
Yes.
if that's okay. Talk to us about the background of Las Vegas Integrative Medicine and how you founded this place right here in Las Vegas.
So I moved to Las Vegas about 10 years ago. And that's when I started the practice. It was under a different name. So I was seeing some patients with the naturopathic medicine while I was going to school here for acupuncture. And after I finished the acupuncture school, that's when I started the Las Vegas Integrative Medicine in the current location that we have, which is about a little bit over 5.5 years ago. So since then, we've grown up a lot. We've expanded. We have multiple providers in the office. So, but originally one of my goals was to because Las Vegas in Nevada, naturopathic medicine is not regulated, and it's very difficult to find the naturopathic doctors here. So I wanted to be able to serve more community here, of course, introduce it to people who are not familiar with it, and also incorporate acupuncture because I'm from Korea and I believe in the acupuncture and the herbal formulas. So I wanted to combine them because they also can work together synergistically, complementing each other as well.
Right. And I think maybe it's a good time to start this conversation talking about naturopathic medicine, because for some people it may still be a foreign concept, but this is something that you've studied and it's being a big part of your practice. So tell us a little bit about it.
So I define that the naturopathic medicine as a lifestyle medicine. Because, of course, there's a lot of things. There's a functional medicine is a part of it too. Functional medicine, some people are more familiar with it because there's some medical doctors who are thinking outside of box and working outside of box, practicing some functional medicine. But more than anything, because I believe in the power of taking your own responsibility for your own health. Everybody should learn how to do it because, unfortunately, under the current, healthcare system, people are not familiar with taking care of their own, taking the responsibility for their own health, taking charge of their own health, because you've rely on the insurance coverage, you rely on the doctor's diagnosis and what they prescribe you. When there's a lot more than you can do for yourself. Of course, there's a medical intervention may be necessary here and there, but at the end of the day, nobody wants to or should be taking the medications for the rest of your life just because you need it at the beginning. And without changing your lifestyle, without changing your diet, without some other natural supplements, it's hard to do it just by taking medication. And that's what I hear from a lot of patients too. This condition keeps declining once they got on the medication because of their side effects. And when you want something easy and quick, that's what you're gonna end up with. Right. So a lot of our practice includes educating patients and educating the public too, because I want people to know that there are a lot more that they can do without relying on other people. And at the end of the day, it should be your decision on what to do for your health. And when you make that decision, you want to make the educated decision, informed decision, not just because you're the only one thing. And another thing is also there's so much information out there. Right. With the internet access, a lot of people are confused what they need to do. But everybody is different. So another thing is that the individualized approach per their need, because everybody is different depending on their body's reaction and the history. We try to personalize it too, but it's always a process. And it's very important for anybody to be ready to commit to that process, to be able to see the light at the end of the tunnel.
And what's really great is it obviously is you're making a difference, a connection, because like you said, this practice is growing. You're opening a grand opening of your second location. Obviously, there's a big need out there. And Rachel, I wanted to bring you in because you've been with this practice. Was it from the beginning, or have you been there for a while?
I just came in earlier this year, so about 9 months or so.
9 months ago. And talk to me about what you do and what drew you to be. And you're a naturopathic doctor as well, right? Yes. What is it about it that you feel like this is, what you want to do to serve your patients?
I guess I'll give a little bit of my backstory. I was born and raised in Las Vegas, in the accounting and finance world for as long as I could remember.
Wow.
And then that recession happened in 2008.
So medicine hasn't always been your passion.
It wasn't.
Yeah.
It might have been, but I didn't think about it at the time. When that recession happened, my grandmother got sick with cancer, and then because I had more time than the rest of my family, I essentially became her caretaker at the last year and a half of her life. And so that was kind of what got me in, was to see what the traditional healthcare system was able to provide for my grandmother and how limiting some of the resources were. And so that kind of planted the seed that there should be more out there, just more options for patients who want it. Especially there was a very huge cultural disconnect. Because with Asian medicine, right, we're very used to using food or herbs as our medicine. And when we bring these ideas up to the doctors at the time, they basically shut it down and said, no, you cannot do any of this.
So that really stuck with you of how that affected your own family.
Yes.
So was there a turning point that you're just like, now I want to do something like this with my life? Going through that experience.
That's kind of what got my wheels turning. And then I tried a couple, science classes just to see how I felt with it. And it was really when I felt like I was in my element, like just learning about all the different sciences, medical everything, and then it kind of just took off from there. Why I ended up with naturopathic medicine was because it is a form of medicine that gives us more options and gives patients more options as far as like how they want to heal themselves. Right, so 10 people can come in with a common cold, but we could potentially give them 10 different types of therapies based on where they're at with their lives and their lifestyle and what's approachable for them. So,
and because you like that kind of personalized care that you can give each individual that comes into your clinic as well.
Absolutely.
And it's just, and what I wanted to kind of share with this practice that really appealed to me, especially with Veterans Day coming up too, right? That veterans are a big part of your patients. And I know Chris is one of them. We're going to hear from her in just a bit. But Yoojin, talk to us about this, your focus on veterans and why was it such a big part of your practice?
So about a year ago, we started to take the TriCare for the veterans. And since then, we've gotten a lot of veteran population come in for the pain management. And they were, many of them were getting treatment from the VA hospital. However, because the VA has a limited resource when it comes to the acupuncture, they were not being able to get the regular treatment. So they were searching outside. And the TriWest was helping us to treat the patients too. So a lot of people that we see, especially veterans, they do appreciate the care very much because it helps them to stay away from the medication or minimize the need of medications and be able to function, perform the daily activities more closer to normally. So we've been getting a lot of support a lot of good shout outs from the veteran community for that. Unfortunately, naturopathic medicine is not necessarily integrated into the VA system or TriWest because more than anything, especially in Nevada, because we're not regulated, unfortunately. So hopefully that will happen down the road, and I think Chris will be able to say a little bit more about that.
But you're helping to educate it. I mean, we got some pictures from actually some of the events that you were at, including one just a few weeks ago where Chris was actually in attendance to, where I got to meet her, and she shared her experience of how this has helped. This is from that event at the Veteran Resource Center. And Yoojin, you said that this was kind of part of the mission of the clinic as well. It's not just to keep your practice in the clinic. You're going out in the community to share this, right?
Right.
Yeah.
We want to educate the public. That's the thing. Because I do believe in the power of each individual to help themselves, but also help to change the system. I don't believe it's going to come from top down. It has to start from the root. It has to start from the people asking for it. And then they'll probably start to think about that. So educating public is just as important as treating the patients, because it comes from your own healing power can come out only when you believe it.
And you've seen that happen with many, many patients, right?
Yes,
yeah,
indeed.
Yeah, and Chris, I'll bring you in the conversation now. You were at that meeting, and I'm sure you've been part of this, conversation before. Talk to us a little bit about your backstory and how you became such a big supporter of alternative medicine, especially now that you're part of the VA system, right?
Right. I'm a partner, strategically partnered to be an advocate with the VA. I am a Make the Connection candidate as a poster child of evidence-based therapy as a kidnapped survivor. I am that poster child when it comes to trauma and the mental health inclusion of the healthcare system. Veterans are not all with post-traumatic stress. That's something everyone can experience. Right. They're just a isolated population that is noted and documented the most to actually have those types of healthcare experiences. As a patient, I'm a patient, I'm a beautiful being as, here as a human being first. But then with all of these life experiences, I'm a patient. I am a research patient. I'm at UCLA and the Cleveland Clinic. I have toxic exposures, and my body systems failed me. I was in the Western medicine military complex experience of the opioid crisis. That lasted for years, 7 years of constrained pharmaceutical scheduled medication, constant appointments, 2 to 3 appointments of physical body health in specialty clinics. Each one of those had a medication and another medication to help with the side effects. I was on DMARDs and biologicals for 17 years. My conditions, and most veterans that have toxic exposures, are breakdowns in their immune systems. There is no protocol for that. Therefore, Western medicine does not suit it. Rather, it's a symptomatic experience that they have to adhere to, which leaves us in a lot of community development issues, right? So when you talk about actual side effects, we're talking about mental, psychological, neurological, and immune system side effects, heart side effects, organ system side effects. Well, with that medication that's treating something that may or may not be biological, because less than 2% of our diseases are biologically created. So you're treating something with a medication that isn't truly biologically. And then we go into the history of medicine and Western medicine. We are much longer in history when it comes to the naturopathic medicine and Chinese Oriental medicine, African medicines, Kemetic medicines than we are with Western medicine. Western medicine is new. It's just something that can be funded and tracked a lot easier. And when we look at what medicine really is, and I know the doctors will help you understand that that is something that's financially tied to coding. So you have a lot of individuals that are misdiagnosed off of symptoms when actually there was a mind-body connection with trauma, toxic exposure experiences connected to it. As a poster child, the whole health program out of Salt Lake City, with the support of University of Utah, being a research patient back then, I integrated into acupuncture, chiropractic care, Jahara, Watsu. I'm talking Middle Eastern medicine, Asian medicine, African medicine, my spiritual practice. I'm a certified plant medicine and mind-body spiritual practice. So even for myself growing up indigenous, I did not have these diseases before I went into the military. I had a lot of things that created it. And when people come to me as an advisor to talk to me about what do we do for our patients? What do we do for our clients? Well, first you have to understand the population, the socioeconomic, and the actual long-standing effects of them. These doctors are able to do that, whereas a Western medicine doctor is put into a matrix of time and numbers.
And I wanted to, and that's, I mean, it's such a complex story.
Absolutely.
And you have so much background in this, and I'm sure, you know, we can learn so much from everything that you've gone through, and thank goodness you're here to be kind of the supporter, because a lot of people don't understand. It's such a complex issue, and I'm sure we'll get back to that. But Rachel, I mean, these stories are not uncommon to you. You hear this, right? Talk to me just maybe some of the examples that you've seen in the clinic in terms of how the way that you guys are practicing at Las Vegas Integrative Medicine has really changed their lives, like how Chris has gone through that.
I think the biggest difference that our patients will experience from us is that the first appointment, we're going to schedule at least an hour time with the patient, one-on-one time, getting to know them, pull out every detail that we can about everything from head to toe. So even if it's not the main concern that they want us to help with, we're still trying to figure out what's going on with their body as a whole, like spiritually.
And that's not typical of what a Western medicine doctor would, because they don't have the time, first of all, right? But you guys are making it a priority to make that part of your practice.
Yes. And then once we gather all the information, put all the pieces together, then it makes it easier for us to decide how to prioritize what labs are absolutely necessary, what can wait until later, and then we teach them, you know, lifestyle, dietary changes to kind of work through all the different layers piece by piece, I guess.
Yeah, and you know, and Yoojin, go back to what Chris was saying, that this is a long-term, this is a lifestyle, right? So that she has to kind of change her life to make this, and she's making a difference for other people like her as well. But talk to us about that, because you're kind of asking, in a way, they're going to become your patient, to be committed to your practice for a while, because this is part of changing their life, and not a one-time, come in, I'll fix you, right?
Right.
Yeah.
Yeah, so there are a few things that I emphasize for especially for the new patients. There are 3 C's that I emphasize a lot. That's very critical for us to see the improvement and the result they want. And the 3 C's are basically commitment, compliance, and communications. So commitment to the process is definitely very important. If they're going to fall off after a couple of visits, it's going to be very hard for us to keep up. Sometimes they stop it because they saw some change, they think it's enough, but apparently it's not. It takes more. So they fall off, and they might come back a year or a year and a half after, saying that everything is back because it was just not enough. So that's commitment is to the process is definitely very important. The compliance, because at the end of the day, it's not about just popping in the pill and be done with it.
Yeah.
You have to make the changes in your life, and sometimes it's easier said than done, and sometimes it sounds like very cliche. However, it's very, very important part. So we try to help them make the changes, step by step per whatever they need. But at the end of the day, they have to do it. So unless they're ready to make the changes, again, there's no quick fix or shortcut with the natural medicine. Another one is communication, because if we don't know, we cannot help. So the communication is very important. So it's very important for us to build a strong rapport and strong the doctor-patient relationships. So once they become a member of our practice, we encourage them to communicate with us, let us know what's going on. If there's anything that we can do, we can help with our approach. However, if it's something that we cannot address, we'll have to refer them out, of course, because we cannot do everything.
Yeah, talk to us about some of the services that you offer there, because it's not just acupuncture, and it's not just, you know, you do a wide array of services for not just veterans, but anyone in the population, right?
Right. So, yeah, we definitely, of course, serve the local community. We have some patients coming from the outside of the state as well. But mostly naturopathic medicine, which includes homeopathic medicine, the botanical medicine, nutritional counseling as well. And that all, so lifestyle include lifestyle plus some medical intervention approach with the functional medicine as well.
And it's about that blending both
right,
of them
it's
together,
all blending
right?
because everything has what is best at.
Right.
But when you put it together, it always works the best. So, and on top of that, we do acupuncture as well. So we're definitely not a counselor, but some patients come in and they sometimes often say that, oh, I feel like I'm in a counseling right now.
Because that's the experience that you're giving them,
exactly,
right?
because we ask a lot of questions about their life in general because we need to know everything what affects their health to understand what's going on and to give them proper advice and recommendations.
Yeah.
So it's different.
It's just so much information, and I know we can talk for hours. And given the limited time that we have, I do want to let people know that you guys are opening the second location, meaning that you can now serve more patients. And Rachel, I just want to get you to kind of, we'll pull up the pictures of these new doctors that you're having, but basically talk to us about what people need to know. If they want to come and see you, they can just come and get more information, right at your clinic. And now that you have two places.
Yeah. So it's still the same phone number that you can call to schedule an appointment or inquire about our services. We do have two buildings, so more
both on
providers.
Jones, right?
Yeah,
Near
both on
Chinatown.
Jones.
Yeah.
So there's more providers that'll be able to help serve our community.
Yeah.
And I don't know, what else do we just give us a call?
Yeah, I mean, you guys now have more resources, and that's the thing. And Chris, before we wrap this up, just for you, someone who really believes in what these two ladies and their team are doing, what do you want to tell people out there, especially veterans, who are maybe seeming to be in a place that maybe where you once were, that you feel like there's no hope? Where can I get help? What do you want to tell them?
I want to say thank you so much for that, because that's instilling hope. You don't have to feel trapped that the prognosis, the diagnosis is an end-all be-all. We have been conformed into believing this is the only way, and this is the only result that you're going to get. You're going to have to take this pill for the rest of your life. That's not always the case. We are evolving beings, and
in your poster child, you said
the
of
poster
this,
child.
right?
So after 7 near-death experiences,
Yeah.
in 50 surgeries or procedures, with all of them not producing this quote-unquote healing, the healing is what we acknowledge from the education and knowing and believing that we can heal.
Yeah.
And this is not the only way. It's an entourage, like she said.
Right.
It's all the things. And being able to find it. Veterans are used to systems. We're programmed to believe that everything's in a one-stop shop because that's what we lived into.
Right.
And so when you have an actual practice like they have that integrates all of this into the functioning whole person experience, and I know she didn't mention it, but she also makes sure your family is involved, because your family,
That's a
this is
big
a
part of it,
practice,
right?
this is a part of your life.
Yeah.
You can't do this alone. You're not alone. So no matter what you do, if you don't come to this organization, if you're looking for that hope, use this as a model to believe that there is another practice and another way for you to seek the healing that you're supposed to feel every day.
Yeah.
You don't have to feel this pain every day, mentally or physically. There is hope.
Yeah, and Yoojin, this is the message you want to get out there, especially as you're expanding and reaching more people in the community, right?
Yes, definitely. And sometimes people may not know whether this is the right approach for them or not. And it may not be the right approach for everybody necessarily. So if you're not sure, you can just call and ask if you have any questions before you make a decision.
Yeah. And and I think this grand opening celebration that you have coming up, and I think we have a poster, we want to share it one more time to let people know, because this is the time they could come and get to kind of see what you guys are all about, right? The Las Vegas Integrative Medicine grand opening of their second location, that is coming up on November 4th, Saturday at 11:30. It's going to be a big celebration. This is a community event. If you want to learn more about naturopathic medicine, which Chris knows a lot about, you all know a lot about, but I think it's still foreign for a lot of people, but it could be very helpful, right? Like it has helped you. So come join. We'll put all this information up for them. And thank you so much, Yoojin and Rachel and Chris, for coming in and sharing more. What this could be really life-saving for a lot of people out there, right, that don't know.
Yeah. So just one more thing. the new providers that were coming in, they're acupuncturists. Because the naturopathic medicine is not regulated here, it's very hard to get the new providers. And that also limits our scope of practice, unfortunately. However, with the acupuncture, we can fill in that gap somewhat, not completely, but
and
somewhat.
we're showing some pictures now of these new providers, and they provide, you said, something that is hard to find here.
Even the
in Southern Nevada.
acupuncturist is not easy as some other states like California or Arizona. In the state of Nevada, unfortunately. So we're expanding, and the acupuncture is definitely growing in our practice as well. So if anybody has any problems or any questions, I would say just reach out and ask.
Yep. For sure. Las Vegas Integrative Medicine now operating in 2 locations, the grand opening happening on November 4th. Well, thank you so much to you, Yoojin and Rachel, and of course, Chris, for coming in to share your story and your expertise, and thank you for being here.
Thank you so much for having us.
Thank you, and thank you everybody for watching and listening to this episode of Entrepreneur Showcase Series. We'll see you again next time.